Add this to your dog's bowl and watch Plaque and Tartar disappear in 24 hours. Your dog just breathed on your face again, and this time you actually noticed it. That thick, sour smell rolling off her tongue like something has been sitting there for days. Look at her back teeth right now. That yellow-brown crust hugging the gum line is not staining from her food. It is a bacterial colony that has been hardening, layer by layer, since the last time anyone looked closely. Before we get to what goes in the bowl, there is a mistake almost every loving owner makes that keeps that crust coming back worse than before. And once you understand it, the rest of this makes a lot more sense. I have been treating dogs for about 20 years now, and this is one of those things that comes up in my exam room every single week. If your dog is snoring next to you right now, tell me in the comments what breed she is, because in a minute you will want to check something in her mouth. Stick around, because I am also going to tell you honestly whether that 24-hour promise is even real or whether something else is actually going on. Here is the guilt part, and I want to get it out of the way immediately. You are not a bad owner because you have not been brushing her teeth every day. Almost nobody does. In 20 years of practice, I can count on one hand the households that manage a daily brushing routine, and most of the dogs I see with lovely teeth belong to owners who never touched a toothbrush either. The fact that you are watching this, worried about that smell, already tells me everything I need to know about how much you care. So let's clear up the myth first, because it changes how you think about everything that follows. Most people believe bad breath is just a dog thing, something you live with, and that brushing occasionally is enough to keep on top of it. It isn't a dog thing. Persistent bad breath means bacteria and minerals are actively building up on the tooth surface, and every day you skip is a day that buildup gets a little more permanent. That single shift from normal trait to fixable problem is the whole reason this video exists. Here is what is actually happening under that crust you just looked at. Within minutes of your dog eating, a thin, soft film of bacteria forms on the tooth. That film is called plaque, and at this stage it is still soft, still removable, still nothing to worry about. Left alone though, minerals in the saliva bind to that film, and it hardens into something brushing alone cannot lift. And that hardened layer has a name too, tartar, sometimes called calculus by your vet. Once tartar sets against the gum line, it traps more bacteria right where the gum meets the tooth, and that ongoing irritation is exactly what produces the smell you noticed a minute ago. None of this happens overnight in one dramatic jump. It happens in a quiet, daily cycle that either gets interrupted or doesn't. Think of plaque and tartar the way you think about wet cement and dried cement. Wet cement wipes away with a cloth. Dried cement needs a chisel. Every single day, your dog's mouth is either staying in that wet, workable stage or crossing over into the stage nothing at home can undo. I tell owners something similar about their kitchen counter. Wipe it every night and it stays workable indefinitely. No scrubbing required. Skip it for a week and suddenly you need a scrub brush and real effort just to get back to where you started. Your dog's mouth runs on the exact same logic, except the counter is her teeth and the sponge is whatever daily habit you build around that bowl. So what does that actually look like on your own dog day to day? A little morning breath is completely normal. Every dog has it. And that thin, invisible film right after a meal is nothing to panic about. Your dog's mouth resets that every day on its own. What is not normal is odor strong enough to change the room, and that yellow or brown crust building along the gum line, especially on the back molars where you were just looking. That crust means tartar has already started forming, and it deserves attention, though not panic. The next sign is a little more serious. Red or puffy tissue right next to that crust means the gum itself is inflamed, which is the stage vets call gingivitis, gum inflammation that starts exactly where tartar sits against soft tissue. You might also notice a little blood on a chew toy or on her water bowl rim, which is the gum telling you the same thing in a different way. And if you ever see your dog pawing at her own mouth, chewing oddly to one side, or dropping food she normally loves, that has crossed out of cosmetic territory into pain, and that calls for an actual visit, not another home remedy. If you saw that crust while she was breathing on you a minute ago, keep watching, because what happens next explains exactly why this matters more than a smell. Here is a mistake I see constantly, even in owners who are trying hard. They hand their dog a dental chew once a week and consider the job done. Or they buy the fanciest kibble bag with a tooth icon on the front and stop thinking about it further. Chews and kibble shape can help a little with the chewing motion itself, but neither one interrupts that daily plaque window the way something added to every single meal does. A weekly chew against a daily build-up process is simply outmatched, no matter how good the chew is. Because none of this stays quietly in the mouth. Plaque hardens into tartar within days of being ignored. Tartar irritates the gum line into gingivitis within weeks. Untreated gingivitis becomes full periodontal disease, slowly eating away at the bone that holds each tooth in its socket over months rather than days. Teeth loosen. Chewing starts to hurt even if your dog never tells you so directly. And the same bacteria sitting in an inflamed mouth do not stay there either. They can enter the bloodstream and add a slow, ongoing strain to the heart valves, the liver, and the kidneys, which is something we see far too often in older dogs who came in for something else entirely and left with a dental referral too. This is the part that surprises owners most. Your dog's mouth is not a separate system from the rest of her. An intestine thrown off balance often shows up in the skin and ears, and a mouth left untreated for years often shows up quietly in the heart and kidneys on senior blood work, long before anyone connects the two. Cleaning up the mouth early is one of the cheapest things you will ever do for the rest of her, not just for her breath. Here's a number that surprises most owners the first time they hear it. By age 3, most dogs already show some measurable sign of dental disease, which makes it one of the single most common findings in an adult dog checkup, well ahead of most other chronic issues we see at that age. That's not a scare statistic, it's just how quietly this builds when nobody is looking at it closely. I want to tell you about a dog I saw a while back, a 9-year-old terrier mix, brought in because guests kept commenting on her breath from across the room. On exam, she had moderate tartar and early gum redness, not yet the advanced disease we sometimes see, but clearly heading there. We started her owner on a labeled kelp powder in the bowl every day, plus a nightly 30-second wipe along the gum line. Within 4 days, the owner told me the breath alone was noticeably better. By the 6-week recheck, the soft plaque film was visibly reduced. The one thing that hadn't budged was the hardened tartar band already sitting on her back molars, and that still needed a scheduled professional cleaning, which finished the job completely. That case is basically the whole answer in miniature. So let's get specific about what actually goes in the bowl. The ingredient that keeps showing up in my clinic and in the research behind these dental products is a kelp or seaweed powder, most often from a plant called Ascophyllum nodosum, or a vet-formulated tasteless dental water additive if your dog is picky about texture. What it does is simple. It helps keep that fresh plaque film softer, so more of it rinses away naturally with saliva and chewing, and it slightly reduces the bacteria responsible for the odor. It does not dissolve tartar that has already hardened onto the tooth, and I want to be honest with you about that up front, because that distinction is what makes everything else you do here actually work. If this is the first thing that has made real sense to you about her mouth, that is exactly why I'd ask you to hit subscribe. No goals here, just more dogs getting this kind of straight answer, and a like helps this reach more owners scratching their heads over the same smell tonight. Dosing matters here, and it depends entirely on your dog's size. For small dogs under 25 pounds, that is about 1/8 of a teaspoon daily, stirred right into the bowl. Medium dogs, 25 to 50 pounds, move up to 1/4 teaspoon. Large dogs over 50 pounds go to about 1/3 of a teaspoon. Start at half of whatever amount applies to your dog for the first week. Let her stomach adjust, then move to the full daily dose from there. If you go the water additive route instead of a powder, follow whatever capful per water volume the label gives you. And again, start around 1/4 of that dose for the first 3 or 4 days before working up to full strength. As for what you'll actually see, fresher breath and less new plaque film often show up within 1 to 3 days, which is where that 24-hour promise comes from, honestly, since some dogs really do start smelling noticeably better within the first day. Softer, thinner existing plaque tends to show over the following 1 to 2 weeks. But I need you to hear this part clearly. Tartar that has already hardened on the tooth is not coming off from anything in the bowl, 24 hours or 24 weeks. That requires an actual cleaning. A few practical notes owners always ask me about. If your dog is a picky eater and won't touch food with the powder mixed in, try stirring it into a spoon of plain wet food first instead of dry kibble. The smell hides better there, and most dogs stop noticing it entirely within a few days. If you don't see any improvement in breath after 10 days at the full dose, that's usually a sign the tartar is more advanced than a bowl additive can touch, and it's time to have her mouth actually examined rather than raising the dose further. since raising it past the labeled amount only raises the iodine load without adding benefit. And if you ever run out of the powder for a few days, simply resume at the regular dose when you restock. There's no need to reload with a double dose to make up for missed days. Her mouth won't lose ground that fast from a short gap. Here is the safety part, because I would never hand you an ingredient without telling you where the edges are. Kelp is naturally rich in iodine, and while labeled dental products are formulated to stay well under the safe daily amount for a dog's body weight, more is never better. Never exceed the labeled amount for her size. If your dog has any thyroid condition or is on thyroid medication, talk to your vet before adding kelp at all, since the extra iodine can interfere with how that condition is managed. Only buy a product labeled specifically for pet dental use. Unregulated bulk seaweed powder sold for humans or gardens carries a real risk of heavy metal contamination, since seaweed absorbs whatever is in the water it grew in. And a pet-labeled product is the one that's actually been tested for that. And while we're talking about the bowl, keep xylitol, sometimes labeled birch sugar, along with grapes and raisins, onion and garlic, cooked bones, and any concentrated essential oils, completely out of anything you make at home for her teeth. All of those are genuinely dangerous regardless of how good they'd be for plaque. Introduce any new addition gradually over 3 or 4 days and watch for vomiting or loose stool, backing off if either shows up. And know the hard limit here. Once tartar has hardened and gums are inflamed or bleeding, no bowl additive reverses that. Only a professional cleaning does. And pain, bleeding gums, loose teeth, or facial swelling mean a same-day vet visit, not another week of waiting to see. But there is one more piece, and it is the one that actually makes the 24-hour change real instead of wishful thinking. Pair the kelp with a 30-second gum line wipe, just a damp cloth run along the outside of the teeth right after you add the powder to the bowl, once a day. That combination is what turns a passive supplement into an active daily reset. And it is genuinely easier to keep up than a full brushing session most owners quietly abandon within a week. Now, I'll say something that might ruffle a feather or two. A lot of the premium dental chews and prescription dental diets lined up on pet store shelves lean far more on marketing than on actual mechanism, charging a real premium for something a cheap, properly labeled kelp powder and a damp cloth do for a fraction of the cost. That is not a conspiracy. It is simply that a jar of kelp powder does not carry the same profit margin as a bag of prescription kibble. So nobody is racing to tell you the cheap version works just as well for most mild to moderate cases. I'm not against those products. I am against you thinking they are the only door into your dog's dental health, when the door that actually matters most is the one you open with your own hand at dinner time. What that pricier shelf rarely tells you is how much of the result depends on you, not the product. A supplement, any supplement, only does its job when it's used every day, not when it's bought once and forgotten in the back of a cabinet 3 weeks later. The dogs I see with the best mouths in my clinic aren't the ones on the most expensive food. They're the ones whose owners built one small habit and kept doing it without fail. If your dog has already had a professional cleaning at some point, or gets one in the near future, this daily habit is exactly what keeps that clean slate from sliding back into the same crust within a few months, which is what tends to happen when owners go back to doing nothing the day after the cleaning. Think of the cleaning as the reset, and the kelp plus the wipe as what actually holds that reset in place. One more habit, and then I'll let you go check on her. Do not add several new supplements to her bowl all at once. A dog's stomach handles one new thing at a time far better than a pile of them together. Introduce the kelp powder on its own for 2 full weeks before adding anything else new. And if you do add other things later, spread them across the week instead of stacking everything into the same bowl every day. So here is where we landed. That crust is not staining. It is buildup that has a fixable timeline. A labeled kelp powder in the bowl, dosed by her size, paired with a 30-second gum line wipe, starts softening that fresh layer and improving her breath within a day or 2 for a lot of dogs, while anything already hardened still needs a professional cleaning, and the iodine dosing needs to respect her size and any thyroid history she has. None of this requires a miracle product or a complicated routine. It requires one small thing added to a bowl she was going to eat from anyway, done consistently instead of occasionally. Tell me in the comments what size your dog is, small, medium, or large, since that is exactly what decides her dose tonight. If this helped you understand what is actually going on in her mouth, hit subscribe and leave a like. It genuinely helps more owners find this before that smell turns into something bigger. Go check her dose, add it to her bowl tonight, and give her a scratch behind the ears while you're at it. She has no idea any of this is coming.